Hello, my name is Dr. Christian Wolf. It's a pleasure to meet you. As a plastic surgeon, I treated a long time patient with lipedema, and my motivation as a plastic surgeon, of course, is to relieve symptoms, to make life quality for patients better. And this is the motivation for lipedema, because it's about life quality. You want to have the relief of pain, the relief of heaviness and swelling, and you want to gain back the motion. So this is my motivation to be on a journey with you, to help you and to treat your lipedema. Lipedema, is just like a kind of a new illness or diagnosis. Back many years, doctors didn't know about this illness. And so a lot of patients are on a long journey and misdiagnosed. I want to help to change that. We treat it very early and relieve your pain, your swelling, to get back to a normal quality of life, to a self-esteem person again, because of the physical and psychological reason the illness is threatening you. To explain lipedema, it's affecting the adipocytes, the fat cells, but it's kind of a chronic and systemic inflammation you have in your body. And the adipocytes, the fat cells, are swollen, are full of water, are big, and compromising and affecting the vessels for lymphatic drainage. And that's why you have also just like compression on those drainage-giving lymphatic vessels, and the swollen legs are just from a wrong drainage, and the heaviness comes with the swollen legs. See, the chronic inflammation of the altered fat cells, adipocytes, it's also affecting the blood vessels, very small blood vessels, just like affected and compromised also by swollen fat cells. And you don't need very hard pressure on the tissue. You don't need a very push on the leg, on the skin, that those very small vessels, which are also in this general inflammation disease, very thin and vulnerable. So it's very easy to break for those vessels up and to make a small hematome. So you don't need very even push on the skin to break those vessels and give hematome. That's why you don't even remember where you got this hematome. It's the reason because you carry a lot of volume of water with you, a lot of swelling in the legs. There's a misdirected drainage in your legs with this inflammatory disease that lipedema comes with. So you feel fatigue, you feel tired when you're standing the whole day and you have these swollen legs or maybe swollen arms, and this makes you exhausted, this makes you tired, even you feel the whole day pain and struggling from the heaviness, and that's why you feel that. This is just for a good preparation for you for going to surgery. Women, compared to male patients, always have a little bit less iron conditions in the blood, but to prepare you perfectly, because you will have some kind of blood loss during surgery, it's important that you help your body maybe with a little bit of tablets and pills you take to increase your blood or iron level in the body. Water is a perfect medium to do sports for ladies, for patients suffering from lipedema, because the water gives a slightly compression on the skin, on the leg, for example. And this compression will help you for a better drainage, for a better circulation of the fluid in your legs, in your arms. And even you don't feel the heaviness, because water gives you feel light, just like you move more lightly then you're out of the water and don't stress your joints. And so you can easily move when you swim with a little bit of compression on the tissue. Even the cool water swells you a little bit down in the legs, in the arms. And that's why it helps for the circulation and moving, and even the muscle pump in your legs, for example, helps you while you move, while you swim, with a little bit of the compression to regain a better circulation, to reduce the swelling. Swelling is that what you're suffering from lipedema. Warm weather or warm climate make it more worse for you, the swelling, because the vessels get more wide and not very strength and tight, and the circulation will not be that good as just like you have a colder climate. So the swelling is more worse when it's a warm weather condition, and even if you're standing or sitting, it makes your swelling more worse. So it's better to move, to walk, even do some sports, Nordic walking for example, to have a better circulation in your legs. The period affects the effects of the lipedema, because lipedema is very sensitive to hormonic changes and alterations. And if you have period, for example, you suffer more from the symptoms of lipedema. The healing is a process, so it takes time. The same as the illness or lipedema is developing over years, the healing takes a longer time, not suddenly after a surgery. So it takes time to heal, for you to deswell, that the tissue gets tight again after surgery, and the lipedema or the edema is out of the tissue. So it takes time for you to regain and have better conditions after surgery. So it takes around weeks or months. Even lymph drainage makes it more better. You see the results a half a year or a year after. They work in a different way. So normal fat cells would be sensitive for you in doing exercises or doing diet. And lipedema fat cells, as altered or chronic inflamed fat cells, they are resisting to exercise. The volume is not reducible through diet. So even more, they are also retending water. So your legs are swollen. So they are resistant to any kind of reducing them, just like diet or exercising, and they swell and affecting lymphatic vessels, blood vessels, and other tissues. And even if we do liposuction, do surgery for your lipedema, the fat cell itself, it looks in a different way than a normal fat cell. It's more a normal one, more whitish, and a lipedema fat cell, it's more in a brown colored fat cell, and even more heavy and thicker than normal fat cells. The psychologic aspect is a very important part of this disease, because it's a chronic disease, and maybe it's affecting you by your self-esteem, by your own body picture you have of your own body. And a lot of doctors make misdiagnose of this disease, and nobody's helping you. And this, of course, all in all makes or can develop a depression as well. So the psychological part is a very important part coming with this disease. There is in fact one really emotional story of a patient. She was running for a surgery for the legs, as very, very common. And she is a woman of 2 children. And before surgery, she was threatening because of the heaviness, the thickness of the legs. And she was going with her child to a playground to have fun with the kids. But the emotional part is after surgery, she was so happy. She was so happy to have a quality of life back, to join life with her child again, to go to a playground, to play with them, just like have fun with them, to give them emotions, because she is there without no pain, and she can even move her legs better, because you have to imagine the thickness, the swelling also reduces the move of your joints. And when you can move again and play with your child, that was very, very emotional. I would encourage her to go for surgery that's releasing her symptoms. I know it's just like you have risk of a surgery, you also have risk of anesthesiologic reasons maybe, but it can reduce your symptoms, your swelling, your heaviness, your pain, and gives you back a normal quality of life with a self-esteemed situation. Maybe you're struggling psychologically because you're on a long way because of your illness, but this can help you.